Hi, welcome to today's episode. Today I'm talking with one of our amazing scoliosis patients, Will, and we discuss a specific type of scoliosis that is a neurological scoliosis from a Chiari malformation. Will was diagnosed with scoliosis and then found out he had a Chiari malformation and ended up needing surgery for the Chiari, and he is recovering from that, and he talks about how that recovery was with the Chiari malformation surgery, as well as his journey with scoliosis. Will is an awesome patient, and he is very consistent in doing his exercises, very consistent in doing those things that help his back, and he has an interesting story, and I think anyone who maybe recently was diagnosed with scoliosis or recently had the diagnosis of a Chiari malformation could benefit from hearing his story and hearing how he dealt with the challenges that came. And he's still recovering from Chiari surgery, and that's going to take a little bit longer, but he's doing fantastic. And I really applaud him for his consistency and his dedication to doing those things that are helpful for his scoliosis curve. So I'm grateful he spent the time to talk to me for a little bit, and I hope you learn something from his experience and that you can take something away that helps you to have a better scoliosis journey as well. So without further ado, here's Will. Hi, welcome to this episode. This episode we're going to talk to Will, who has an interesting scoliosis journey and interesting scoliosis story. And I'm excited to have him here. He's here with his dad, Brad, and hopefully they can share some really cool stuff that can help others who might be diagnosed with scoliosis or specifically a Chiari malformation, and we'll get into that a little bit more. But Will is a patient of ours here at Align Therapy, and he is one of the most compliant patients I've ever seen. And so I really wanted to do a podcast episode with him just to see how he has such a good attitude. So Will, welcome to the podcast. Introduce yourself a little bit, maybe your dad too.
All right, I'm Will. I'm 13 years old. I had a Chiari malformation. I had a surgery in March. So, how long is that ago?
4 months?
4 months, yeah. So, yeah. And then this is my dad, Brad.
That's me. I'm Brad, Will's dad, and I've been with him through this whole process. So it's been a journey for sure.
Yeah. And it's been interesting. I've been able to see the PT, the therapist side of the journey, but that's only a piece of the story. So we definitely want to see what else there is in the journey. And so maybe, Will, give me an idea of how you were diagnosed with scoliosis, what you remember. Your dad can chime in if he wants, how that process went, and let's kind of go from there.
So, I was diagnosed, I was at just a yearly checkup or whatever, and they told me touch my toes and to see if I had scoliosis, and they saw it, and it was tilted. I was curved, my back was curved, and then, yeah, so then they scheduled a checkup and stuff for however many months later, months later, but, yeah, and then we checked up, we got x-rays and stuff, and then probably 2 weeks later or something like that, we got results and saw the curvature and stuff, and they said, and then probably a month or two after that, we started back bracing because it helps it not progress while you're sleeping. It prevents it.
So you're in a night brace.
Yeah, night
right?
brace, not day brace. That's basically
it. So. Go ahead.
Yeah,
Brad.
I was just going to say it was a bit of a shock because Will has been very active since a pretty young age and has been very into competitive basketball. And so to have this come out of the blue was pretty shocking because we had never heard of any issues from previous doctor's visits, and all of a sudden he's got this somewhat severe curvature in his spine. So it was a surprise for sure.
And it was probably interesting because he had been to wellness visits before, yes. And then all of a sudden it was whoa, what are we dealing with? Here's a curve that's progressive, and now we need to brace, and all this stuff coming at you at the same time, right, Will?
Mm-hmm.
How did you feel about that? Did you have a lot of questions? Were you freaked out? Were you just yeah, this is just another day in Willtown?
I would say I just felt it was just surprising, but I knew that I'll be good by the end of it because of all the stuff we were doing to prevent it and stuff. So yeah, that's basically it.
My first reaction was, what can we do just from a physical standpoint? What exercises can we get him doing? What stretches can we get him doing? But we went to YouTube and we found some stuff. We found a few different videos, but started to quickly figure out probably a hard thing to do, just self-guided.
Yeah, definitely. I don't know if you were there on that visit when he was diagnosed or when he saw the surgeon, but did you ask them about that? Did you ask them about what else can be done?
Yeah, when we got the suggestion to do night bracing, it was like, how necessary is this? How proven is this? Yeah. Is this something that will reliably prevent further curvage or help to correct curvage? And they built some confidence for us there, because it's not a small investment. I think it's over $1,000 to get that brace made, so I wanted to have some confidence that it was going to help. Right. But yeah, they just told us that the combination of physical therapy with the brace is the most proven non-surgical way to correct it, so that's the path we took.
Yeah. Will, what did you think about the brace? I mean, that's bracing's kind of a rough thing. Luckily you didn't have to wear it during the day, but what'd you feel about bracing?
My first reaction was that it was annoying that I had to wear a shirt under it, but I knew at first it was kind of just annoying, and then I got a comfy mattress, so it was fine.
You got a comfy mattress?
Yeah.
You got a new mattress to offset the bracing.
The discomfort of the bracing.
Did you sleep on your back before?
Yeah.
So you never had to change that?
Yeah.
That would have been annoying for me.
Well, I can sleep on my shoulder too. I can sleep on my side too with it. So.
Have you been able to sleep on your stomach with
it? With my face down.
That's how I slept all growing up, on my stomach.
I actually have some patients who are braced that sleep on their stomachs still.
That's crazy.
I'm like, I don't know how that works, but they seem to be able to do it. Was it uncomfortable to get used to?
Yeah, honestly, it wasn't that uncomfortable. It was just annoying, waking up, because I'd be, sweaty and stuff. It's just kind of gross, honestly.
Kind of gross, getting up all sweaty. And
yeah.
Summer, well, I guess at the time it wasn't necessarily summertime, but
yeah.
I always say that bracing kind of sucks. If we can avoid it, let's avoid it. But if we can't, it is effective. So so let's use it. So at that point, you got a brace, and I remember when I saw you in the clinic, you have an interesting curve. Your curve goes to the left, and in boys that have the left thoracic curves, it's a little bit of a red flag to us that something else might be going on. And the doctor that you saw at primaries also had a similar thought, so they did an MRI, and what did they find?
They found I had the Chiari malfunction. It's like my fluids are getting clogged up in my brain stem, is it? Mm-hmm. Yeah. And then putting pressure on my spine, making it curve and stuff. But yeah, I didn't really have any other symptoms besides that, but that's pretty rare, I've heard. So. Right.
Yeah, it's not the common thing that's causing scoliosis, but it definitely can be. I mean, we here at my clinic, we see a few every year that have a Chiari malformation, but it's, Did you know what it was when they were talking about it, or were you like, what is this now that we have to deal with?
I didn't really know what it was, honestly.
You didn't know what it was.
Yeah.
Now you do.
Yeah,
I don't know why you would know what it was.
No.
So.
I had a coworker who had Chiari malformation surgery in his 20s the year before, so about 6 months before we learned about Will's diagnosis, so that was kind of crazy. I would have had no clue.
That was the only thing.
Well, and I remember as a PT, you'd think that physical therapists would know what a Chiari malformation was, but before I started specializing in scoliosis, I didn't know what a Chiari was. And it's when it's brain surgery, right? It's kind of freaks you out maybe a little. Will doesn't get freaked out by anything. He just kind of rolls with it. But I don't know, Brad, as a parent, when it's like, now my kid has to go through brain surgery, how was that?
I mean, everything you would expect. It was nerve-wracking and scary and terrifying. I would say probably one of the hardest things to watch your child go back under the knife and trust that they're going to be poking around in his skull and do a good job, and also trust that it's going to have the intended effect that they're looking to have, since it's not a direct surgery on the spine, right? It's kind of this ancillary thing that it's like we hope that it helps. It should help to prevent future issues that could crop up as well. So it's kind of this interesting surgery that it's not directly addressing anything. At least in Will's case, he didn't have numbness or any sort of vertigo or other things that can crop up, and so it wasn't directly addressing anything. There was hopes that it would address the spine curvage, but yeah, it was definitely scary and something we had to trust the recommendations of the doctors involved.
Right. There's some sensitive things in that area, in the brainstem area, right? So were you freaked out at any point about the surgery?
Honestly, not really, but like I know that other people like have a lot of stuff that I feel like for other people it'd be way harder, but honestly for me it wasn't too bad. It was just a little, like it was just annoying that I couldn't do anything for like a month, 2 months, yeah.
So let's get into that. You like basketball. That's kind of an understatement. You love basketball. So being down and not able to play basketball, and before surgery, I remember your back was hurting as we were seeing progression of the curve, right?
Yeah.
And I can't remember, did you stop playing basketball because of that? Or,
no,
okay, so you're pushing through that.
Yeah.
So you went into surgery. How was recovery? I think that's a question a lot of people have, is how was recovery?
Yeah. So like the first week was the hardest because I was in the hospital still. Like the first day you just sleep the whole time. You're kind of like, you just like are nauseous and you throw up a lot. Yeah. But you can't really eat anything. Like it might sound like you want to eat something, but like anything just disgusts you. Like even that day I ate before, like, because they told me I could eat like 12 hours before I ate food that day, and every time I see that food I get nauseous now.
Oh, really?
Yeah.
What was it?
It was like this salad thing, and then like sourdough, eggs and toast with cheese on it.
Oh, that's too bad. That does sound good.
That's what I eat every morning, so now he stays away from my breakfast.
There you go. It's a way to repel him from your breakfast.
Yeah.
So you were nauseous. I bet throwing up after surgery isn't the most fun process.
The first thing I did was throw up.
Especially with all the trauma to your neck and you're seizing up, and he did not have fun the first few days.
Yeah.
And I forgot to ask, do you know what degree your curve was before surgery?
It was the last time I checked, it was 32. Yeah, 32 before the surgery. It started at 22 though, and then it progressed to 32.
Yeah, that was in a short amount of time, right?
Yeah, it's only like 5-6 months.
Yeah, so we were seeing that progression. It was at 32 degrees. Obviously, right after surgery, like you said, Brad, this isn't a surgery specific on the spine, and so we kind of have to wait a little while. But how long were you in the hospital?
Only like a week.
Not even. 4 days.
4 days in the hospital.
Mm-hmm. Okay. Yeah.
So the nausea was there for the first, day, 2?
I say the first 3 days.
First 3 days?
Yeah, that's really when they sent him home, was once he could keep food down.
Oh, okay.
Mm-hmm.
So I think it was about 3 days before he could keep anything down.
Yeah. I just ate grapes and smoothies the whole time.
Grapes and smoothies. All right. Were you on pain medication? Was that why you were nauseous?
They had an IV right here.
Yeah, he was on an IV, but they said it's more because the Chiari messes with the nausea center of the brain. So less to do with the medication and more to do with the brain trauma that you're healing from.
Trying to adjust to that and heal from that. That's interesting. So that may be something that other people could expect to have is that nausea.
Yeah, my friend said the exact same thing. He said the worst part is having the nausea and throwing up when you're recovering from
Yeah.
all the neck and head trauma.
Yeah,
Yeah.
and you can't really like walk at all. You need help to walk. Like it's the worst thing ever. Like going to the bathroom, because someone has to help you at all times to
Right.
get to the bathroom and
You
stuff.
can't really bend over. You have to
Yeah.
like stay straight. or
You're
else
super
you get
shaky.
dizzy. Yeah.
Right.
So you gotta have a helper.
And you're a pretty independent kid, so that's probably like,
Yeah.
man, somebody has to help me. Do
I
all
got
this
out
stuff.
early though. They said so.
Yeah, good, good. So how long before you're able to play basketball?
A month and a
5
half.
weeks, I think.
Yeah, like a month and a half.
Okay. And during that 5 weeks, did they have any restrictions on what you could do? Like, was there something specific?
It's honestly just I restricted myself because I knew that like if I did certain stuff, it would affect me in like bad ways. So
Okay. So you kind of held off from doing some things that were a little more intense
Yeah.
because you wanted to heal a little bit more.
Uh-huh.
Okay.
I think they said 4 to 6 weeks, but listen to your body.
yeah,
Yeah.
it wasn't super restricting, like nothing insane. Like you can do everyday things, just not really like push yourself in anything too hard.
Right. So you're back to basketball now.
Mhm.
And do you feel any pain, any restriction in the activities that you do now, or you're pretty much 100%?
So I just have headaches. Like if I get too insane, like do too much, like push myself too hard, I get really bad headaches. And but lately it's been dying down a little bit, I'd say. Just like I just take ibuprofen or something. Even if I don't take it, it's been getting a lot better. But then like
Good.
if I have like loud, like super loud sounds, or like being loud myself, like I just get like super nauseous and yeah.
Are you loud a lot? Loud yourself?
Yeah.
Only when he plays Fortnite.
Oh, okay. So you have to tone down Fortnite
Yeah.
a little bit. Okay. Cool. So you guys went to get an X-ray recently to see what the scoliosis curve is doing, because we have, we kind of have two things. We have the Chiari that now is fixed, and I think your surgeon, didn't he say it looks pristine, like the most perfect
Yeah.
recovery he's ever seen, or something like
Yeah.
that.
Yep.
So that's fixed and good, but we still have the scoliosis curve that we are watching and treating. So you guys had an X-ray, was it this week? Is that right?
Yeah, I was.
And what did that show?
It showed the curve got a lot better. It like went down like 3 or 4 degrees
Good.
from like 32 to 20 or 29. I can't remember.
Which, with the curve that had been progressing, to go down that's fantastic. That's the way we want to go, and hopefully over time we continue to just see that
Yeah.
go that direction. So are you still wearing your brace?
Yeah, I'm still wearing my brace every night.
Okay. And one thing we didn't talk about before surgery, you did start Schroth method exercises here at the clinic, and you got pretty good. I'm thinking about having you teach the class at this point.
Yeah.
But tell us how those went, because you've been doing those after surgery as well. But how are those? Are those hard? Are they complex?
Yeah, they're not too bad. It's just like, yeah, it's just hard to remember sometimes, obviously, because, yeah. But when you get consistent and stuff, it's not too bad. And as long as you have the right materials at your house, then it's not bad at all.
Right. Well, that's good. Consistency is key, and I think you're very consistent with the brace and with the exercises. Yeah. And maybe tell me, why is that? Why are you so consistent? Is that just, and maybe Brad, you can tell me too, is that just how Will is, or where's the motivation for you to be consistent with it?
Just to get the curve better and stuff. Maybe get the brace off earlier.
Right.
But yeah, that's basically it.
You don't want to keep the brace forever and sleep in that brace forever.
It'll be your little cocoon for life.
Yeah, there you go. Wake up sweaty every morning for the rest of your life.
I'd say Will, when he gets his mind set on something, he's determined to get it done. No one else can tell him what to do if he doesn't want to do it, but if he wants to do it, he'll get it done. And so
yeah,
like that's how he's applied that same thing to this issue in his back. So
that's perfect. Well, and I think it seems like that internal motivation is really pushed him to be able to do that. So that's great. Will, maybe you can give some advice to anyone that's, let's say, someone that's diagnosed with scoliosis or diagnosed with a Chiari malformation. What advice would you give them? How would you help them through that process of knowing what you know now?
I would just say, like, be open about everything that's happening. Like, if you have any pain, tell, like, your parents or whoever you have. Tell your physical therapist anything that's happening, like, and if something's uncomfortable, let anyone know and maybe it can help change it. And for surgery, I'll just say, like, honestly, don't think about it too much. Just, like, do the things you love before, and then you'll know that after the surgery is over with, you can get back to that stuff.
Was that motivating for you to get back to basketball?
Yeah.
Yeah. Like, I think.
But it was nice to have a break sometimes, obviously.
Right. A little break, a little brain surgery to take a break.
That's all it took.
Yeah, there you go. So, Brad, any suggestions for parents who might be going through the same process?
Yeah, it's like I said, it's hard to trust sometimes that the methods being recommended are the best. So I would say trust the doctors that you're going to, but our experience with the Schroth as well as bracing, it's been really positive, and then the surgery is a whole nother monster, but in our experience so far, it's been positive. We're seeing the curve decrease now, as well as the syrinx or the buildup of fluid in his spine has cleared out, so that should prevent those future issues. But like I said, it can be hard to trust that this is going to address the pain or the potential future issues, and so far so good for us. The only downside has been the migraines that have come on after the fact that we didn't have before, so we're hoping those clear up. But yeah, I'd say trust the method, and for us it's been key for Will, like I said, to have the vision of I want to accomplish this thing versus having a big battle to go do the physical therapy for the day. It's been key to have him have a vision of where he wants to get his body to, and hold himself accountable to be consistent on those things.
Well, and I think you guys have done a really good job on helping him to be accountable rather than forcing him to do those things. Having him be a part of the process, I think is really cool. So
yeah, it's been great.
Well, that's great. Anything else you want to add, Will, while we're...
No.
No?
I think that's it.
That's it. And the story continues. I mean, I'm hoping that this curve just continues to reduce over time, and you're still consistent with things, and we can get this curve to continue to get smaller. Mm-hmm. So I think those headaches that you're having, I think those will continue to get better over time, but it does just take time. Your body has to learn how to respond to those things. So, well, cool. Will, thanks for being here, and Brad for sharing your thoughts as well. And we appreciate you being on the podcast.
Yeah.
Absolutely.
Thanks for having us.